Good afternoon, everybody. Welcome to our 3:30 update on COVID-19 for Eau Claire County. We appreciate, again, people paying attention, getting local information, and sharing that with people in your networks. It is April. It's hard to believe. It is also, for many, April Fool's Day. I will not be providing any April Fool's humor today. My apologies. My children would say I'm not very funny anyway, and this is a serious situation. So we really are here to share with you what is happening and give you that update. Today we also have Dale Peters with us. He is our liaison officer. It's a role in Incident Command that really helps support connecting across our county as a whole, particularly with government. So he'll be here to share a little bit about the work that that group is doing, as well as what's happening in the city of Eau Claire specifically. The news from the White House, if people were listening to that yesterday, was probably difficult for many to hear, that we could see 100,000 or more deaths nationally as a result of this disease. Big numbers cause all of us to pause, and we've known for a long time that this disease is probably going to touch every one of us personally, and I think it was another reminder yesterday. It also underscores that we have to pay attention to the public health actions that we're taking now. All of us need to do that. It's important that we make sure that we are staying home. In the best case scenario, when people stay home, they are limiting their contacts. We'll stop the spread of the disease in a way that will not happen if we are out interacting broadly. Stay at home works. It helps us bend that curve. I think we also heard from the state last week that if we didn't implement the stay-at-home order, the estimates were more than 22,000 cases by April 8th and between 400 and 1,500 deaths by that point in time. So that's only a week away from today. And the estimate at that point in time when we started the stay-at-home order was that kind of an impact. So today, again, we will share some local updates and statewide updates, and then Dale will share with us as well. In Wisconsin, we have 1,550 positive cases for COVID-19 from testing, an increase from yesterday of 130 positives. 24 deaths. We're now 2 more than yesterday, and 18,819 negative tests across the state. Testing capacity is increasing. More tests are being done. That's been part of the work that the state has been very focused on. And we are continuing to work with our healthcare providers and the state to make sure that that capacity is available in Eau Claire. Again, some have asked about the cost of testing and the cost of treatment. The understanding from the state, as we work through with the state, is that testing and treatment for COVID-19 is a service that will be covered. We are working with the state to determine the actual process for that, particularly for those that don't have an insurance system in place personally. In Eau Claire, we have 15 positive COVID-19 cases, an increase of 3 from yesterday. We have tested almost 700 people. 692 people have been tested, with 523 negative tests. The remainder of the tests are pending. Again, the reminder is we have about 100,000 people in Eau Claire, and again, 692 of those people have been tested, a small proportion of the people in Eau Claire. It's a small representation of likely the disease happening in this community. People may be sick with the disease with minor symptoms, but those aren't necessarily people that we are testing. It's also a reminder that in our numbers, the numbers tested, the numbers positive, those are Eau Claire County residents. Sometimes there's confusion because we have a regional healthcare system that tests and treats many, many people, that when we report numbers that we're talking about all of the things that are happening in Eau Claire. When we report numbers, we are reporting people with an Eau Claire address that have been tested in any facility and may be treated in any facility, but that are Eau Claire County residents. So sometimes people say, we know about all kinds of more people that got tested or even additional positives. If they were not an Eau Claire address, they are not in our numbers. I also want to share a bit that we have very typically just shared with you numbers. We will continue to do that. We do get questions about hospitalization, and we can tell you as we work hard to protect information about our cases that we do not currently have anybody that is hospitalized. We did have one individual in that group who is no longer hospitalized and is doing well. One of the reasons that we hesitate about hospitalized information is that it changes literally minute by minute. Someone might be hospitalized and go home. Somebody might be home and be hospitalized. So of our cases right now, we've had one that was in the hospital at this point in time, and they are now home. We also want to stress that anybody can get this disease at any age, and our age distribution is wide. We also are testing certain people at a higher rate, so those over 65 in nursing homes with disease and symptoms might be tested at a higher rate as well. It may mean that we have more testing numbers at that age group than we would others. In Eau Claire, we've had people as young as high school age and people over 60, that full range of people in our caseload. So now I will turn it over to Dale, and Dale will share with you some information about what is happening across the county from his perspective, as well as the city of Eau Claire. And then I'll come back and share a bit more about Incident Command and take questions. Thank you.
Thank you, Liska. Of course, as you know, over the past few weeks, all of us have been preparing for the arrival of the coronavirus. And as Liska just pointed out, it is here, and this insidious virus is now pushing its way into our community. And as was pointed out, unfortunately, that march is going to probably continue to invade our community for some time. Local governments at all levels, the cities, the counties, the villages, the towns, have all been working together to prepare for this. We are building in redundancy and resiliency into our essential services of police and fire, 911, our sewer system, transit, elections, all to support local government and to keep it running at all levels. Again, all levels of local government are in regular communication. The cities and the towns and the villages, we're working together for a coordinated response and coordinated information for all of the residents within our county. So this afternoon, I'd like to talk about a couple of areas: the event itself, voting, businesses, which are hurting quite a bit right now, and our community response. As you likely can understand, this is certainly a very unprecedented event, and very, very few people in our community have ever experienced anything like it. From the Spanish flu of 1918 to the Great Depression to World War II, this is going to require self-sacrifice and thoughtfulness around how we creatively help our friends and our neighbors. And not only those who are scared or hurting from and worried about the illness itself, but that disruption is happening to our lives. And of course, that impact that's happening to small business. So I'd like to reinforce that it's time to stay calm and stop the spread, and that this is indeed a very serious situation, and that now more than ever we must follow the recommendations of our health experts, especially the talented and skilled people of the health department, which is being led by Liska Giese, and they have a very informative website, and it's important to pay attention to that website and watch it daily for the information that is there. In terms of voting, we've been doing a tremendous amount of work. It is happening in the state of Wisconsin, and all the local municipalities have been preparing to vote. It's your constitutional right, and we're doing everything we can to have that be done in a way that's safe for the poll workers and safe for the people that are executing their constitutional right to vote. One of the best ways to vote right now is to participate in the early voting that is happening. Certainly within the city of Eau Claire, early voting is an option at the City Hall parking lot. You can do it by driving up, biking up, walking up, scootering up. Any way you can get in there, we will process that vote early outside with very good spatial distances between yourself as a voter and the poll workers that need to work with it. Other options are available throughout the county, and you're encouraged to talk to your county clerk if you're not a resident of the city of Eau Claire on how you can vote early. There's also been considerable work that's done on how we're going to conduct the election next week on Tuesday, with some some intentional work on how we're going to lay those voting sites out, the spatial distancing, the protection for the voter and for the poll workers, and we'll have a lot more information for that available to you on Friday and then also on Monday. I'd like to talk a little bit about the business community. The business community is hurting, and it's hurting a lot. And for those of you that are in the business community, know that we are doing everything we can to help with which we can do at the local level within the resources that we have. But also, there was a $2 trillion federal package that was passed, and we are exploring and looking at ways to be able to help our local businesses access those funds and be able to use them to continue their business. We're working closely with all of the business-related organizations in the community. So the economic development people at the City of Eau Claire are working with the Chamber and working with Visit Eau Claire and working with the Economic Development Corporation so that we can closely work with businesses to coordinate how we can get access to those funds. There's CBDG funds for not-for-profits. There's funds that are going to be in economic recovery loans. There's going to be non-forgivable or forgivable loans that are the Small Business Association, and also money coming through FEMA. That can be very complex, it can be very confusing, but know that we have people that are working at sorting that out and getting opportunities for business to be able to have access to that funding. And then as to the community, of course, Eau Claire, and I mean that in the broadest sense of the Eau Claire community and our surrounding area, we are a community of caring and compassionate people. And more than any time in other generations, it's time for us to step forward and take care of each other. Respecting, of course, that social distancing, but it's time to check on our neighbors, find creative ways to socially support each other, support those local businesses by buying gift cards or doing the takeout if that's a possibility, or doing other things. And of course, as Lisa pointed out, make sure that you find ways to stay healthy. Mentally healthy and physically healthy, be creative in how you do that. And most importantly, be informed with facts. It's very easy to be fearful at this time, but be informed with facts. And this update every afternoon at 3:30 in the City of Eau Claire City County Health Department website are certainly one of the very best places for you to find those facts and be able to operate from fact rather than fear. These, of course, are unprecedented times, but working together, we are going to get through them. Back to Lisa.
Thank you, Dale. Clearly, our leadership at the city and the county level across our county are critically important partners in this, and we really appreciate their being part of making this a success in this community. Couple of additional reminders. Again, as Dale said, voting is a large priority since that's next week, Tuesday. A reminder to people to absentee vote if they are able to. If you are able to absentee vote, please go to myvote.wi.gov until tomorrow to get an absentee ballot sent to you. That absentee ballot will help because you are doing it in your home with a witness in your home to witness that, and you can mail that absentee ballot back in by Tuesday. It is important that we decrease the number of people that have to vote in person if possible, and that is our quickest and easiest strategy to do that for people across the county. Dale mentioned in-person voting through the city of Eau Claire, but for everybody else, please also consider absentee voting. Some of you may be aware that the governor has requested from at the state level some opportunities to look at absentee voting that might make it a bit easier. I have not heard yet today that any of that has moved forward. That did include the ability to not have a signature on the ballot. It's my understanding at this point that those that are absentee voting would be voting witnessed by someone with their signature and a signature of someone else on that ballot. There are lots of creative ways to do that if you do not have someone in your household to help support that. You can video do that over a video chat and have someone watch you sign your own ballot and get it done, and then put that ballot outside the door and have that person on the outside of the door sign it and then have it come back into you, and a number of other strategies like that. So we really encourage people to think creatively about meeting the requirements with absentee voting and making that happen. Also know that our incident command has been working again for the last couple of weeks, but very intensively this week to make sure that polling sites for those that show up in person are set up in a way and that there are processes in place to keep those polling sites as safe as possible across all of Eau Claire County. Information, as I said yesterday, went out to all of the clerks across the county. 37 different sites in the county will have in-person voting next week, Tuesday. And if you go to those sites, you'll likely see some signs that aren't typically there if you are a regular voter, and we hope you're a regular voter. You'll see some things that are a little bit different to make sure that not only the poll workers are kept safe, but you are as well. So there will be a little bit of a different setup and a process. There'll be some new signs. There will be requests to clean your hands as you go through, to use a pen that you don't leave there unless it's being cleaned. So you'll notice some changes, and those are all parts of the process that we've worked through this week to make sure that we're protecting the health and safety of poll workers and of residents. Incident Command, as I've said previously, our response is working on a lot of different things. A couple of highlights that I'll share with you today include a team that has been working the last couple of days but has added capacity today to really do some research on where is this going, what are the ways that we can most efficiently respond, what can we learn from other parts of the state and country as well as other countries. So we have a team locally really trying to reflect on what will happen next, what are the best practices locally, and some more intense work there. We certainly have been doing that all along, but we are happy to have a couple of additional people to help us do that. We also have done some more considerable work really focusing on supporting law enforcement. Law enforcement, both from the group that is working in law enforcement, making sure that they are protected and doing their jobs, which we so essentially need them to do, but also that the community is protected in the spread of disease. So there have been many conversations over the last number of weeks, but again, ratcheting up those conversations to be sure that everybody has their questions answered, that our law enforcement professionals feel protected, and that they know the right information for their job around enforcement. People may know that the rapidly changing discussion about enforcement of the stay-at-home order is, for example, difficult to get on top of. And so working with law enforcement so they have the most current information, both City of Eau Claire Police Department and Sheriff's Department, but all of our other local law enforcement professionals. So again, those are little tidbits of the much work, that the really whole variety of work that's happening in Incident Command. It's kind of from A to Z topics. As I shared with someone yesterday, every headline and news story you see that's happening nationally or globally, we're kind of working on those issues locally as well. Those types of topics are things that we are addressing locally and looking at how do we move those forward efficiently and successfully in Eau Claire. I will again remind people of the website, coronavirus.echealthdepartment.org. Our COVID-19 call center for Eau Claire residents that would like to talk to someone after they've looked at that website and they still have questions, please call the COVID call center hotline, and that is 715-831-7425. A reminder with our sign again here today is really our message is as much as possible for people to take a deep breath, to stay calm, to stay informed, and make sure that you are, if you have to reflect at the end of the day, doing all those things to help us not have disease spread in Eau Claire County. So with that, I will open it up to questions. Yes?
If you could just clarify real quick, you said it was an increase of 130. We're seeing the number is closer to 200 of an increase since yesterday. Can you just clarify maybe on that, make sure that we've got it all?
Yeah, so the data that we pulled from was 1,550 cases statewide. So we will clarify whether the math was not done correctly or we looked at it at a different point in time. I don't have that for you right now, but we certainly can do that. The question was a difference in numbers that people were seeing from the state totals. And again, the state totals that we pulled down were 1,550 positive cases for COVID-19. Other questions? Yes?
I guess, is the state still waiting, like a lot of other states are seeing a dramatic spike, like huge numbers in 24 hours. Is this something that Wisconsin is still potentially bracing for? Maybe what would spike look like within the state? What numbers would be considered to be, I guess, extreme for the state?
Sure. So the question was, other states are experiencing very large spikes in numbers over the course of a day. What might that look like in Wisconsin, and what would we consider a large spike? So the challenge of that is that we don't exactly know. We're doing about 4,000 tests a day. We started that this week. Last week, when tests were done at the end of the week and the beginning of this week, of that 2,000 number, if we start getting 50% or more of those, obviously there would be a huge concern. I would say an increase of anything more than 20% would be something that we would, at least locally, definitely paying attention to. I would not be surprised if the Eau Claire numbers double over the course of 2 or 3 days, and that's part of the understanding of this disease. Numbers will hopefully start flattening out. That's the point of the stay-at-home order, but we need to be at least 14 days into the stay-at-home order to start seeing a little bit of flattening out. So I don't anticipate the state numbers or the local numbers to be flattening out or slowing down in the near future. Yeah.
You mentioned that the conversations around how law enforcement is enforcing the stay-at-home order are rapidly changing. Has the city of Eau Claire or the county sheriff's department, considering changing how they enforce this order, and have they responded? Or
Sure. Yeah, so really around enforcement of the order, and my apologies if what I said was not as clear as it needed to be. We have a group that is working together for enforcement of the order universally across the county. So all of our law enforcement are getting the same materials, the same information about enforcement, and that's coming through a legal team and a person that is specifically tasked with enforcement. What is changing is some interpretation of the order statewide. Questions get raised as new things bubble up to people's minds about, can this happen or can this be open? And as WEDC, the Wisconsin Economic Development Corporation, as well as the state health department work through those specific asks, we are seeing a few changes come forward to us that we then need to incorporate into our work locally. We have really wonderful law enforcement partnership, and we are counting on that continuing. Our priority for the stay-at-home order continues to be very strongly education, assuming people want to do the right thing and may need a bit more encouragement to do that, may need a bit more education to understand it fully, and then only using enforcement when it was necessary. Yes?
This might be more for Dale. With tomorrow being the deadline for the absentee ballots, that gives 1 week before, the election. Can you say, maybe where the county sits in regards to, are we still good in the supplies in regards to absentee ballots, the envelopes, and is it going to give enough time for them to get their ballots, since it is such a higher demand this time around compared to what would be a normal election?
Sure. Good question, and the question is really the amount of time and resources and supplies available to handle the absentee or early voting requests. And so the clerks at all levels are working very hard to be able to respond to that request. So, for example, over the weekend within the city of Eau Claire, we had people stuffing envelopes, all weekend long. We have purchased probably all the labels and envelopes in the city that were available to be able to do that. From a ballot perspective, unless there was going to be substantially more votes than you would expect in the election, the ballot that would be used at the regular poll is the same ballot you would use, in absentee. So it's just shifting it from one pile and one time to the other. So, but we have seen, a significant increase. I think normally we would process between 1,000 and 2,000 absentee ballots, and I want to say might even be pushing close to 10,000 now that we've processed either with the early voting or with the absentee ballotings. So a significant portion of the population is choosing and exercising those options to vote early, and we're really appreciative of that, and hopefully that will have lower turnout on Tuesday with still the same or more total turnout because people were able to exercise these options early. But we've brought extra staff, and I know the other municipalities have done the same thing. So there's a lot of extra staffing that's being brought to bear, and we have been able to secure the supplies and materials that we need to be able to process them in a timely way.
And just a real quick follow-up, just remind people maybe on the rules of when do they have to have their ballot turned in by if they are voting through absentee ballot?
Has to be received by the clerk on election day. So, so the best way to do that is to get it in the mail early, or again, at least in the city of Eau Claire, you can bring it down, to and take care of that process at the city hall parking lot. And the other clerks within the county are also working hard to make options and availability and access for people who want to exercise that right early.
I would just add a little additional information to that to say that the Wisconsin Election Group has been communicating with all of the clerks about supplies needed, about resources needed. There is a supply list that is available for those clerks. There has been statewide concerns about enough poll workers and enough ballot availability, and we know that that's out there, but we certainly are working with our local clerks to make sure that their needs are met, and at this point in time do not understand that there are that many. So again, I do want to jump back to a previous question about the change in the numbers. So it is accurate that we have 1,550 positives. That is correct, but our math was a little off, and we have close to a 200 increase, so 199 positives more than yesterday. So thanks for catching that. We're glad you noticed that. Any additional questions? Good. Thank you again to the community for listening and to our partners in the media to make this available to them. I know they appreciate that, so thank you for that. A reminder on this first day of April that we are counting on everybody to stay at home, to follow what we need to do in order to stop the spread of disease, and we'll be back tomorrow to share additional information. Thank you.